What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've already liked and subscribed, then you are here already and know some of the tips and the discussions that we've already had. And thank you. I appreciate you. So today we're going to get right to it. Let's talk about drinking after your prostate surgery. So all you need to be aware that alcohol is not going to affect you the same way that it did before. I'm not talking about mentally or anything like that. I'm talking about as far as your urinary tract is concerned, like how quickly you have to go to the restroom and how that affects down there. As you know, we all go through that incontinence or the incontinence issue. Some of us worse than others. I didn't have it. I mean, I had it, but not really badly. But others have it in different circumstances, and I'm always aware of speaking towards my individual circumstance when in some cases it was better than the others. So I am talking to you just in general about how it is that I navigated it. So what I did is that for the most part, I only drank water for about 2 to 3 months. I didn't drink anything else just because I didn't know how I was going to react. I would recommend that if you're going to have drinks, that you have them first at your house so that you'll know exactly how it is that they're going to affect you. You need to be aware, though, that you may find yourself in social settings where you're going to have drinks. I would recommend that if at all possible, that if you are going out to a social setting to have drinks, that you wear the big pad. Now, we talked about it in another video, but there are 2 pads. There's a smaller one that you wear, and then there's the bigger one that you wear for issues. You want to be aware that you wear the big pad. Now, some of you may not wear it, some of you may not like it, some of you don't. I ain't even thinking about that thing. But here's the thing. Have the drinks at your house at first, and you have to go to the restroom immediately. Your restroom, your house, you can get in there. Please be aware that if you are in a social setting, you may have to wait. It may not be a circumstance where you can go directly into the restroom. And so, as I always said about that thing, because I don't like it, it's like I'd much rather somebody catch me with that on than to catch me with any pee at all on my clothes. So in my particular case, if I have 2 beers, I'm good. The 3rd beer and if even to the 4th, 4 is all I'm doing. But if I get to the 3rd or 4th beer, I'm going to have to go to the restroom a lot. That doesn't necessarily mean that I'm going to have on the pad again. My surgery went well, and so my incontinence issues are not as bad as some of yours, but that's just where the circumstances go. But I don't have to. But it took me a long time to have a hard liquor mixed drink circumstance. My first time, it took me about a year before I even decided to do that, and it was bourbon, straight. And I wasn't really sure how I was going to react. I knew when I first drank it, I was like, oh, it's not that bad. And then afterwards, I was like, oh, okay, so I see what's going on here. This doesn't feel right. And eventually, I'm sure, like I said, I'm not a heavy drinker, but I'm sure that, everyone will get to a point where they are in a better position to understand what their body's going to do and handle it. But just understand that you need to make sure, like I said, keep those pads in the car because you never know when those social circumstances are going to go. You don't want to be in a circumstance where you're like, hey, man, I'm going to have a couple beers. Oh, man, I wish I had one of those. Discreetly keep them somewhere. Your trunk, in your with your car wash kit in the back, something. And if you feel like you need to hide them, whatever the case may be. So if you are going to do that, just plan in advance. Don't sit there and make those decisions and then not have determined what's going to happen. But I will ask you all to do this. The longer you can wait, the better off I believe you'll be. So, if you have to have that drink, I understand. I'm not here to tell you what you should and shouldn't do. But if you can wait, make sure you give everything down there a chance to heal up. The surgery and everything incorporated with that so that your system can get back to normal And then when you actually decide to drink, you'll be in the best position to handle it. As always, fellas, peace and blessings. Holla at y'all later.